So welcome everyone, and thank you for joining today's session on country risk management in the context of Global Fund grants. To get us started, I'll begin with a quick reminder of the Global Funds strategy, which guides our priorities for this funding cycle and through to 2028. And I'll also touch on some of the program results the partnership has achieved. After that, I'll walk you through the Global Funds approach to risk management, including the 4 stakes of risk management, and then we will wrap up with time for discussion and Q&A. So you will have the opportunity to ask any questions and share your thoughts. So let's get started. Next slide, please. Next slide. So diving into the current Global Fund strategy, fighting pandemics and building a healthier, more equitable world, the strategy was developed through a highly consultative process and sets out how the Global Fund partnership can work together. And we say partnership because the success of design and implementation are dependent on collaboration among multiple stakeholders, technical partners, governments, non-governmental organizations, civil society, private sector, community-based organizations, and of course, communities. So it's all about how we collaborate to accelerate progress towards the 2030 targets. The primary goal of the strategy is clear: to end AIDS, TB, and malaria. But to get there, the strategy outlines 4 mutually reinforcing objectives. These are like the building blocks that support that goal. Let's walk through them briefly then. The first one is maximizing people-centered integrated systems for health. This is all about bringing services closer to people and having a system that's responsive to people's needs and provide quality health services. The second is maximizing engagement and leadership of most affected communities. And this one is critical because the communities most impacted by these diseases are the best positioned to lead in the response. The third one is maximizing health equity, gender equality, and human rights. And finally, mobilizing increased resources, because let's face it, none of this happens without the necessary funding and support. So at the time this strategy was designed, there was also what we called an evolving objective on global pandemic preparedness and response. Now, almost 2 years in, I think we can agree that this objective has matured. On pandemic preparedness, the Global Fund supports countries, low-income countries, middle-income countries, in strengthening their pandemic preparedness capacities by building resilient and sustainable systems for health, which are able to prevent, detect, and respond to disease outbreaks and other shocks. This is through investment in health systems like strengthening laboratories, supporting health workforce, and reinforcing community systems, among other areas. And on the pandemic response, the Global Fund work is already well defined by the existing programs like the Global Fund COVID-19 response mechanism, or what we call the C19RM. And we have recently also rolled out support to Mpox response in countries most affected. The strategy also outlines what we call the partnership enablers. You see those at the base. This is about defining the roles and accountability for all stakeholders involved. So what's different about this strategy compared to the previous one? There is a stronger focus on prevention. There is more investment on integrated people-centered services. There is more focus on supporting community health systems and greater emphasis on sustainability and data-driven decision-making. And we also explicitly recognize the role of all actors in the partnership and the importance of accountability. This strategy laid the foundation for the investment case that was presented to our donors during the replenishment process. And our donors entrusted us with the responsibility to deliver on this strategy, reflecting their confidence in us all in the partnership ability to achieve these objectives. And then to ensure coherence and focus, all funding applications must align with the strategic priorities that were set out. So one of the key criteria for the technical review panel in assessing the funding request is their alignment with the overall strategy, ensuring that our efforts remain focused on achieving our objectives. And then, as you all know, once the grants are approved, we as a partnership move forward with implementation. We handle the daily challenge and risks and work together to ensure the effective implementation of these grants. On accountability and transparency, the Secretariat report to the board every 6 months on our progress towards achieving the key performance indicators and milestones. And this is also a reflection of the reports that are received from the implementing countries and from the implementation of all grants. So if we can go to the next slide, please. Many of you have likely reviewed or seen the 2024 results report, which showcase our collective achievement over the past year. It's important that we take time to acknowledge and celebrate the significant successes of our partnership. 2023 was a year of significant progress in the fight against HIV, TB, and malaria. And in countries where the Global Fund invests, we have seen a full recovery from the disruptions that were caused by COVID-19. Also in 2023, we made significant investment in strengthening health system resilience and supporting community systems. The Global Fund allocated 1.8 billion specifically for supporting health systems and community systems. And the aim is to support the systems adapt, absorb, and transform in response to shocks and daily stressors. Again, 2023 was also marked by multiple global crises, extreme weather events, flooding, drought, the conflict, mass population movement, and growing anti-gender and anti-rights movement alongside attacks on civil society. So when we highlight the partnership's success and results in the face of these crises, we also acknowledge the incredible work of national programs, principal recipients, implementing partners, technical partners, communities, and country coordinating mechanisms in this partnership. So from a risk management perspective, we see this also as a country risk management in action. It highlights the ability of the implementers to adapt and ensure that the programs and service provision continue even in the face of major challenges. And we will speak about this throughout this presentation. If we may move to the next slide, please. Next. So one of the definitions of risk in the Cambridge Dictionary is the chance that an investment will lose value. So it's an uncertain event or condition that, if it occurs, will negatively impact the achievement of the program or project strategic and operational objectives. And if we apply this definition to the grant, the risk relates to uncertainty in achieving grant outcomes and ultimately uncertainty in achieving the overall mission of the Global Fund. So for example, there could be risk in the design of the program, that it's not evidence-based, or it's not fully aligned to the epidemiological context, or when the program fails to reach the people most in need. Other risks could include issues like fraud, inadequate data quality, suboptimal supply chain management that could lead to stockouts, and so on. When we look at the risk internally, we define 3 categories of risk. One is the inherent risk, and this is the level of risk before any control or mitigation actions are put in place. So it's where we start without anything being done to reduce the likelihood or impact of the risk. The second type of risk is the residual risk, and this is the level of risk after we apply controls and mitigating actions. And the third one is where we intend to reach, which is the target risk. So this is the desired future level of risk, which we aim to reach after applying new or additional controls or mitigating actions. And when we plan a target risk level, we are obliged to define a time frame to document how long it will take to bring the risk down to the desired level. So for example, if the supply chain management risk in a country is very high due to issues with procurement or quantification or warehousing or logistic information system at the start or before the start of the grant, we invest in building certain capacities through the grant and maybe outsource some of the functions so that we reach a residual risk level, which could be high. And then we continue to invest in the national supply chain management system to bring the risk level down to moderate. So our target risk is moderate, and we intend to achieve that by the end of GC7 grant, for example, or by the end of 2026. So I think after the presentation, you'll have the slides and further definitions of key concepts and the process. So I'll stop here and then move to the next slide, please. I think the risk management process is usually integrated into the program management. So based on the data you have at hand, the program management team, while implementing the day-to-day tasks, consider trade-offs and decisions and determine the best course of action for the implementation. When those decisions are taken, we need to be transparent in communicating those trade-offs. And it's also important to be proactive in risk management. So you plan at the start of the grant cycle, and then as soon as the early signals start to appear, you start looking at the root causes and then design mitigating actions. One of the key challenging aspect is that risk management needs to be dynamic, but also be balanced. Because in all systems, as the system parts and components are connected to each other, sometimes when you attempt to reduce the risk in one area, you may increase the risk in another area. So say, for example, we decide to implement a zero cash policy to reduce the risk of fraud. So we may if we switch only to bank transfers, we may create some challenge when working with some community organizations or community health workers. And in that case, we might want to consider using, for example, mobile money as an action to mitigate this additional risk. I think this will resonate not only with the professionals in risk management, but also with program managers and principal recipients, since this is part of your daily responsibilities. And in fact, these approaches and concepts are sometimes relevant to many decisions that we may take at a personal level too. So if we move to the next slide, please. Next. The overall risk management architecture of the Global Fund is guided by two documents, the Risk Management Policy and the Enterprise Risk Management Framework. So on the right side of this colorful circle, you will see three types of risks. You see the country risk, operational risk, and process risk. The process risk relates to the uncertainty in achieving the objectives of the Global Fund business processes. So it's more like an internal, could be linked to inadequate internal controls or weaknesses in how processes are handed over between different teams. The operational risk also is linked to the secretariat, and this refers to uncertainty in conducting secretariat operations. So could be risk related to sourcing or IT function, which could impact the compliance, staff well-being, and ethical behavior. The third risk, which is the country risk, this is where we will focus today. It involves uncertainty in achieving grant outcome and ultimately the overall mission of the Global Fund. So country risk impact both the individual grant the country portfolio, and also our ability as a partnership to deliver on our commitment. So if we look at the center of the slide, you will see what we call the 3 lines of defense. I'll briefly describe the role of each of these lines, and then we will dive into the details in the next slide. The red is the first line of defense, and these are the teams that manage risks on a day-to-day basis. For country grants, this would be your country teams. The second line of defense, blue, these teams provide oversight, and within the Global Fund, this includes corporate teams like the finance, supply operation, technical advice and partnership, community and rights and gender team, and us, the risk team. And the third line of defense, this is the independent assurance function of the Global Fund. For us, it's represented by the Office of the Inspector General, as well as the external auditors. And then finally, to the left of the slide, you will see enablers that are essential for effective risk management. These include the risk culture, the risk appetite statement, the accountability framework, and all the system processes and tools in place to enable us to manage all the 3 risks. If we move to the next slide, we also acknowledge the critical role of implementers and other key stakeholders in the Global Fund 3 lines of defense model. The front line of defense are the in-country partners and actors, including implementers, principal recipients, sub-recipients, sub-recipients, and the country coordination mechanism. The front line plays a crucial role in managing risk day-to-day when implementing the grants. And you are the ones on the ground identifying challenges and putting in place actions to mitigate implementation risk. And the Secretariat works closely with the country coordination mechanisms, or CCMs, implementers, partners, and other in-country stakeholders to align and prioritize risk management activities and ensure effective program delivery. One of our key partners is the local fund agents, or LFAs, who play a central role in the risk management process. LFAs don't manage risk directly, but they provide assurances to the Global Fund. Assurance that the risk mitigation activities are being implemented effectively. And the model have also evolved towards prioritizing and tailoring LFA services based on risk analysis to ensure that their efforts are focused on the most critical areas for more effective risk management. So when we move to the next slide, we'll speak about the first line of defense. So the first line of defense consists of the teams responsible for the day-to-day management of risk. For country grants, this would be your country teams. And the core activities include 1, identification of risks that could prevent the program from delivering its results. Internally, there is a guidance on how to identify the risks. And we have slides to go over each of these 4 functions in details, focusing on the role only of the first line of defense. The second part of identification, now please, let's start on thank you. The second part of identifying risk is understanding the root causes behind those risks. And this will inform the design of the needed mitigating actions. And then we move to mitigate and control the risk by designing and implementing mitigating actions and control that will reduce either the likelihood of the risk event happening or to minimize its impact if it occurs. The third core activity for the first line is to plan and facilitate the implementation of assurance activities, to confirm if the plan mitigating actions and controls are being implemented, and if those are adequate. And then, of course, regular monitoring and reporting on the evolution of risks, as well as the progress and effectiveness of the mitigating actions and controls. And the reporting is done both internally within the Secretariat, to the board, and also to key partners at country level. And if we are talking about the first line in the context of the principal recipient team, probably these will be the functions implemented by your program management unit, the PR program management unit. We can go now to the next slide, which describes the second line of defense. In the Secretariat, the second line of defense is the business functions responsible for providing oversight. As we said earlier, it's like the finance, supply operation, community rights and gender, program monitoring, and the risk department. And the core activities include development of policies and processes to guide both the first and second lines of defense in systematically identifying and managing the risks. A second role is to provide technical advice and guidance and training to support the first line in identifying and prioritizing the risk, and also designing the needed controls and mitigation actions. And then part of our role is to periodically, regularly review and assess the adequacy of risk mitigation plans and internal controls, provide feedback and the necessary guidance to the first line teams on adapting the process based on the needs. We also monitor the progress of risk management at portfolio management level. So we look at the risk, the different types of risk across the portfolio, assess the adequacy of mitigation actions, and regularly report to senior management and to the board, committees, and to the board. If we apply this to the government PRs, this could be your Communicable Diseases Directorate or Planning Directorate or other units within the Ministry of Health that's responsible for providing policy, advice, and oversight. And if you look at the non-governmental PRs or United UN PRs, this could be your advisory team who are supporting you in managing the risk and the implementation of the program. We can move to the next slide and the third line of defense. And that's in the context of the Global Fund, it's the independent assurance function represented by the Office of the Inspector General and the other external providers, such as the auditors. Their core activity include the audit, which is an independent audit, not only of the grants and the first line, but also independent audit of the second line. We now have an audit of our processes for the country risk management. And the main objective of the audit is to evaluate the effectiveness of the risk management and controls we have in place. Of course, the Office of the Inspector General, or OIG, investigate and conduct investigations into specific risk or issues that get escalated or reported, and provide independent assurance that risks are being properly managed and the controls that are in place are effective. In your own organization, you can think about the units that play a similar role, such as internal audit, external audit, or other independent assurance audits. We can go to the next slide on the risk management cycle. And the risk management cycle consists of 4 key stages. The first one is the identification and prioritization. The second one is the risk mitigation and control. The third is the assurance. And the fourth is monitoring and reporting. And in each of these steps, the first and second lines of defense work closely together throughout the risk management cycle and throughout the grant life cycle to ensure a coordinated approach. So let's start with risk identification. In the context of the Global Fund grants, we prioritize 13 country-facing risks. And you see those at the top of the slide. And this includes risks to program quality and design, risks related to health systems, risk related to monitoring and evaluation, and human rights and gender equality. And we always say no commodities, no program. So we also prioritize the risk related to procurement of health and non-health products, risk related to in-country supply chain, and the risk related to the quality of health products. The country-facing risks also include 2 finance-related risks, one on fraud and fiduciary, and one on accounting and financial reporting. And as aligned with the strategic priorities, the in-country governance and health financing are critical for the achievement of our mission. You will also see that we have 35 sub-risks that feed into the broader country-facing risk category. And as we discussed earlier, the second line of defense had developed clear guidance on how to rate each sub-risk from low to very high. And the aim is to ensure consistency when we are rating the risk. So we follow a risk rating guidance, and we apply the same criteria when rating sub-risks across the grants. And you can see how these risks and sub-risks are connected in this diagram in front of you. So how do we do this on a daily basis? The risk assessment, identification of root causes, design of mitigating actions, and monitoring are all carried out using an online platform called Integrated Risk Management, or IRM tool. And this platform helps in aggregating data at multiple levels, at grant level, at country level, and then at organization level. So for example, if I am a fund portfolio manager and I have, let's say, 2 malaria grants, one managed by the Ministry of Health and the other one is managed by an NGO, I'll be able to see the risk rating for each of those grants, as well as the overall risk rating for my entire portfolio. And then at the second level, we have detailed data on the risk rating for each of those risks. For example, for the malaria program quality risk, broken down by country, region, and even at organization level. And it's important to have that overall view over the level of risk and the drivers, because it helps us as the Secretariat design mitigating actions across the portfolio. So an example of this is how the Global Fund had worked with partners to accelerate the introduction of new nets, for example, into the market, and to accelerate their availability at country level to address the risk of insecticide resistance, for example. And then I think after that, we identify the risks, rate them, and then on the next slide, I will elaborate on how risks are rated. So risks are rated based on 2 key factors, and you see them in the graph. One is the likelihood, and this is where we define how likely it is that a certain event or a circumstance will occur. We assess the probability or frequency of the event, and then the severity, which is the x-axis. We determine the potential impact if that event occurs. And this involves evaluating the potential consequences and the extent of the damage that could result. So for example, in certain countries, we have experience of seasonal flooding. It's highly likely or very likely that by August, we will see floods. When that happens, facilities become inaccessible. And in some cases, we also face destruction of commodities due to poor storage conditions. As a result, there will be an interruption in treatment for HIV, TB, and malaria services. And this will have a high impact on the program. So it means that the overall risk rating, likelihood, likely or very likely, impact, severity of impact is high. So it means that the overall risk rating will be high or even very high, unless we manage this risk and invest in mitigating actions. The next slide will show us that we have 4 strategies to address the risks. We can mitigate, and that's address the risk by putting in place mitigating actions or control. Some risk may be beyond the control or the resources that are available for the grant. And in these cases, we may decide to transfer the risk to another entity that has better capacity to handle the risk. So for example, if you take the example of the flooding and the poor storage conditions, in a short duration, maybe we don't have the resources, or it's not feasible to upgrade the storage of the warehouses or the storage capacities that we have. So we usually transfer that risk to an entity. So we outsource maybe storage to another entity while we are investing in building the storage capacity. We know the reality of the programs and implementations. In certain circumstances, we may need to accept that a risk could materialize. So if we use the same example of the flooding and the impact on the commodities and so on, we accept that in the country we're working on, and unfortunately that's the reality, there will be facilities that will go out of service when there is a flooding. So what do we do? We invest in a surge capacity, we invest in an alternative storage places, and we plan that early. So we are accepting the risk, but at the same time, we are putting in place mitigating actions to ensure that the program is going on and implemented. The last option, which is extreme, is to avoid. So where the risk far outweighs the benefit, we might choose to avoid the risk altogether by not engaging in the activity or in the project. And in extreme cases, this could mean terminating the interventions. If we go to the next slide, when mitigating risks, we follow a clear process. So for each sub-risk, we need to look at the root causes and design mitigating actions to manage those risks to an acceptable level. So country teams, in collaboration with implementers and country stakeholders, as appropriate, they design, plan, and facilitate implementation of the prioritized mitigating actions and controls that will reduce the likelihood of a risk event materializing or reduce its impact. And when designing mitigating actions, the use of national systems is encouraged because we have to support the capacity strengthening. When we talk about mitigating actions, it's important that they meet the 5, what we call SMART criteria. They should be specific. It should be very clear what needs to be implemented, so there is no confusion about the action required. And also we need to be very clear on who is responsible for carrying out this function. The action should be measurable. We need to be able to track its progress and know if it's on course or needs adjustment. It should be attainable or feasible, which is within the control of the actor or the team responsible for implementing it. Does the actor, being the PR or the SR, have the resources available to deliver on this mitigating action? Of course, it must be relevant, directly address the identified risk, and time-bound. So there should be a clear deadline. And when a mitigating action needs some time, like 1 year, 2 years, or over the grant life cycle, it's recommended to have milestones so that we know if we are on track or off track. So we identified the risks, we understood the root causes, we prioritized the risk. Based on link to the root causes, we design mitigating actions to address those and mitigate the risk. What's next? We need to know that what we are doing is really delivering on our target or what we intend to achieve. So in the next slide, I'll speak about assurance. Assurance planning is central to risk management as it provides confidence to key stakeholders like the Secretariat, the country coordination mechanism, and the Global Fund Board that our investments are on track to deliver the program results. It also confirms the effectiveness of the risk management measures in place. So when planning assurance activities, we aim for a balance between two key elements. Retrospective verification, we need to verify that the reported results are accurate. But we also need ongoing insight and a sort of a proactive approach. So real-time insights into critical activities and forward-looking preventive reviews. And all these activities are, for example, in the list of services for LFA. So we begin planning the strategic assurance activities during the grant making process. We finalize it at the start of the grant implementation. And then the assurance plan is updated annually to reflect any change in the context or the risk levels. So for the assurance activities to be effective, they must meet 3 criteria. They need to be tailored to the context and risk. This means considering the nature, complexity, and objective of each assurance activity. They need to be proportionate to the level of the risk. So the higher risk areas may need more thorough and frequent assurance activities, while the lower risk areas may require less oversight. And they also need to be effective and meaningful. So when we design the assurance activities, when we select the assurance activities, these are to identify issues and or weaknesses. And then reporting back is very important because that reporting back is what will inform the development of practical solutions by the first and second lines. And the first and second lines are also responsible for communicating results and recommendations to the relevant stakeholders to help inform decision-making. In the next slide, you will see, in this slide, you will see the characteristics of an assurance activity. And I'll walk you through each of these, but by using an example to illustrate the importance of each and every one of those 4 items in front of you. So if we are concerned, for example, about the risk of fraud or corruption in one of the countries that we operate in, we need to ensure that the risk management processes and controls in place are effective. So we'll hire an independent assurance provider. This could be an auditing firm or consulting firm that has no affiliation with the portfolio or the organization managing it. And the independence is key to ensure that the assurance activity is objective and unbiased. And then the role of the assurance provider is to offer impartial information to the Global Fund Secretariat on how effective the risk management processes and controls are. They do this in a neutral manner without any biases or preferences. And the assessment should be purely focused on facts. And the goal is to identify any gaps or weaknesses in the current systems. The assurance provider should also follow a systematic approach and do a comprehensive review of all areas related to risk management. They look at the processes, the systems, the people in place, and see how the controls are structured and how the controls are being implemented. It's important that the assurance provider has a strong reputation for delivering credible and reliable information. The work is done aligned to the standards of assurance activities. And this ensures that the findings they present are trustworthy. and can be used to make informed decisions. So once the review is complete, the assurance provider presents their finding to the Global Fund. They highlight areas of strengths as well as areas for improvement. And based on these findings, we can then take action to strengthen our risk management measures, reducing the risk of fraud and corruption in the future. We'll go to the last slide in this presentation. And this is mainly about the roles and responsibilities related to monitoring and reporting. This involves the country coordination mechanism, implementers, country teams, and the second line of defense. The country coordinating mechanisms, or CCMs, plays a crucial role by overseeing the implementation of key mitigating actions assigned to principal recipients. They also participate in in-country assurance planning and validation exercises in partnership with the country teams. Country teams, as the first line of defense, they are responsible for monitoring the progress of prioritized mitigating actions during grant implementation. They assess the effectiveness and impact of these actions using information from various sources. And then the monitoring and reporting create a feedback loop that keeps risk rating, root causes, and mitigating actions up to date. As new risks emerge or the risk levels change, these are escalated to the senior management in the Secretariat for review based on agreed thresholds. So we have a forum, key issues meeting, where country teams and second line functions review portfolio performance, the risk, the key mitigating actions, and assurance activities. And it provides cross-functional feedback to the first line on the portfolio risk assessment, which is documented in what we call the country risk management memorandum. And then the portfolio performance committee is the senior management body. It's, sorry, I'll take some water. And then the portfolio performance committee is a senior management body co-chaired by the head of grant management and the chief risk officer. The portfolio performance committee conducts country portfolio reviews, and some of the outcomes of these meetings include the acceptance of a specific risk or maybe approval of different implementation modalities to manage the portfolio risks. And lastly, the Global Fund Board is ultimately responsible for overseeing risk management across the Secretariat. So as risk department, we report biannually to the board committees. The board committees advise the board on a specific risk or make recommendation for decision-making. And then the chief risk officer reports twice per year to the board and provides once per year an annual opinion on the overall risk profile of the portfolio. So this wraps up the presentation on country risk management in the context of Global Fund grant. Moving forward, we intend to continue our information sessions, but maybe focusing on a specific risk or design of mitigating actions and assurance planning. We aim to tailor these sessions to the needs of principal recipients and country coordination mechanisms. So your feedback is very important in shaping the future sessions. Please share any requests for topics you would like us to cover in the future. And thank you all for your time and attention today. And thanks again. I'll hand over to colleagues for the Q&A session. Many thanks. Over.
Thank you, Maysoon. That's great. We only have 12 minutes left for Q&A, but if people can stay, we have a large audience today, Maysoon. So if people can stay a little longer, we can extend until maximum 2:15, so 15 minutes after 2 o'clock our time to respond to these questions. If that's okay with the risk team, I'll pass it on to you, Maysoon, and to call in our colleagues in risk to read the questions before responding so that interpretation can get them in the languages as well. Thank you.
Okay, thank you very much. So maybe I'll start and then or Colin, you can start and then I can follow up. Over to you, Colin. Can't hear you, Colin. I don't know if it's only me or... Okay. No, we can't hear you. So maybe I'll start while you figure out the... So for Timothy, if higher ambition and higher gap means higher risk, does this deter being more ambitious and programming? So I think at the design phase of the grants, and if we focus only on the grants, we look at the ambition of the National Strategic Plan and ambition of the grants, but unfortunately, we are limited by the resources available. So yes, ideally, I think the resources available do determine our ability to deliver on the ambition, and that's why we are off track to the 2030 target, and also that's why we see a lot of gaps, funding gaps towards the end of the implementation periods in many of the grants. And to mitigate that risk, we have what we call the unfunded quality demand and different attempts for resource mobilization to cover these gaps. Is there a plan to make the IRM tool available to PRs and implementing partners? I think we got that request multiple times from different actors, and I'll table this as a request to be looked at, and maybe we report back to our partners on this ask. Do we have the document on the 13 identified risks in French? I think we can have that. We can share the summary of the 13 risks and sub-risks in French. Colin, are you back? No. Okay. So on the fourth question, who should use the electronic risk management tool? So the online platform, the integrated risk management platform, is used currently by the Secretariat. So it's used by the country team and the second line team, the advisors, for providing feedback on the risk rating and documenting the mitigating actions. And I think the question number 4 is linked to the question number 2. So if the tool is extended to PRs and implementing partners, then there will be an access and use of this online platform. We can go to the next. How we determine the milestone? Can PR do by quarter, like subrecipient and sub-subrecipient should achieve the percentage of target things? Yes, so the deciding on the milestone will be based on the mitigating action that's recommended. Sometimes you will define that as, let's say you would like to develop a strategy to address the loss to follow-up on the treatment of HIV. So your milestone could be one, the consultation in country, and then let's say the development of the strategy, approval of the strategy, and then you can monitor the implementation over time. So you determine the milestone based on the consultation with the key actors who will implement the milestone, and also guidance from the second line on what needs to be done to fully address the root cause and mitigate the risk. I wanted to better understand if the country's risk management is done by the PR and reported to the MCP. MCP, is it the CCM? I'll assume either reported to the CCM or the Secretariat. So yes, the principal recipients are responsible for managing the country risks. At the design of the grant, the country team usually implement in-country risk workshops, and that will be a platform where all partners come together to prioritize the risk and design a sort of a mitigating actions. And then the PR would, I think it's an integral part of the program management to have your risk management as a PR. And now I think in the PR rating, you have the PR ability to manage the risk as one of the parameters for the PR performance. And then those are reported to the CCM, the country coordination mechanism, and the risk management is usually shared also with your country team in the secretariat. CCM Nigeria, how do you monitor risk mitigation plan outside feedback from country team and assurance providers? I think for the CCM, because of the oversight role of the CCM, usually in the CCM oversight plan, you have certain risks to be mitigated. And I think the CCM Hub is planning a number of trainings and interactions with the CCMs so that you have your risk mitigation plan and then you report it to the oversight committee would monitor the implementation of this, and then you report it to the CCM. So there is the internal risk management or the grant risk management that's managed by the secretariat, but there should also be a risk management plan, which is more than the mitigation, identifying, prioritizing the risk, and then mitigating the risk that's managed by the CCM and then reported to the CCM, the bigger constituency. The question number 8, you speak about IREM tool without describing it. Please, I want more explanations about it. Colin, are you back online? No, okay. So
Colin still has challenges logging on.
Okay, would you like to describe a little bit the IRM tool, noting we have only 4 minutes?
Yes.
Yeah.
So the IRM tool for now is an internal tool that is used by country teams to document and also monitor and update their risk management. As Maysoon mentioned, it looks at the 13 risks, and under the 13 risks, there are also sub-risks. And based on this, the CTs are able to indicate the risk ratings, select root causes, and define mitigating actions that would be used to address the risk. So for CTs, IRM is currently what is available. But for CCMs, we have the GRUM tool that is available for updating and documenting risk. And I think your risk specialist would be able to assist with the GRUM tool. And it's the grant risk assessment and action planning tool, which is currently available for now. But as Maysoon mentioned, access to IRM would be discussed much later, and then feedback will be provided over.
And then the question from Patricia, CCMDRC, risk management and planning sessions could be organized regularly on annual basis if requested by the CCM. We go to the next. I don't know, Marcela, how we will manage this because we have 2 minutes left. Do you want us to continue a little bit more, or what is your advice?
Yes, Mason, we can continue 10 more minutes if participants can stay, and if presenters are okay to stay. Is that okay?
Okay. Then we have, how do country audit institutions and global fund audit bodies work together? I think there is a big project now on the building public financial management. And there was a meeting weeks ago on that brought all the audits bodies from international organizations and also from countries. So maybe, Marcela, after this, we can share the link to the Global Fund work on the partnership between the Global Fund audit bodies and the national audit institutions. And on the question number 11, thank you for the feedback. When this presentation will be posted as part of the information session, there were a few slides that has the step-by-step approach that I didn't present because time wouldn't allow, but you will find it there, and there we can also share the links to resources that could be of help to the CCMs and the principal recipients. From CCM Mozambique, I would like to better understand whether for grants the CCM needs to create its own risk matrix or use the matrix developed at the beginning of the grant by the country team. So thank you, CCM Mozambique. I think there need to be a risk matrix that's developed by all partners who are implementing the grant. So the discussion on the risk assessment and development of mitigation actions that happened at the start of the grant would inform the evolution of the risk management matrix. So it's not a must to have one tool, but if we, the partnership, the secretariat, the CCM, the principal recipient, have a common understanding and visibility on the prioritized risk and how we will mitigate those, that would be more useful to the grant. Then shouldn't the Global Fund take into account the country context when managing risk? Indeed, for sure. So the assessment of risk and the prioritization and the design of the mitigating actions is not done in silo. And when the 13 country-facing risks are there to help us have a sort of a consistent, systematic approach to look at the risk. But when you are rating each of these risks and sub-risks, it is based on the country context. It's not a theoretical exercise. It's how are the grants designed? Who are the implementing partners? What are the resources available? What support is available from other actors? And we take all this into consideration when rating the risks and designing the mitigating actions. Next, please. Do you have a formal way of getting inputs from LFA teams as well? Do you share your country-specific risk assessment with the LFA teams across the board? So the LFA team, they work closely with the country teams, and most of the LFAs, they request the country team assessment of the risk level before they perform their function, and also the outputs from the assurance activity do inform the risk rating. And the most important thing, when the LFA reports are formulated, the findings are categorized according to the sub-risks and risks. So the assurance and the alignment in presenting the result is there. Will there be a capacity building training for CCM staff and the PR to effectively identify the risks and implement mitigation plans as per the IRM? Yes, the CCM Hub is planning number of events in 2025, and the CCM Hub will be reaching out to you, and we will be working together on that. Can you clarify if cash transfer in additional safeguard policy country is the only solution to the zero cash policy, considering the network challenge among other issues such as lack of means of identification of rural CSOs and community health workers? So CCM Nigeria, this is a very important question. I think responding to this would be better if we are having the country team and having a closer look at the reality in the field. But what I would say that now with the mobile money and new ways of payment, we could mitigate the risks of delay to the program or some of the community health workers not having bank account by this new ways of transferring money. But to have a good discussion on this, I think it's better to have it between the country team and us all and then we can really have a deep dive into what would be the best for the context in Nigeria. Will the mitigating actions identified be part of the action points to be monitored by the CCM? So some of the mitigating actions will be called as a mitigating actions plus or key mitigating actions, and those got populated into the PUDR, and so the CCM will have visibility on those. How frequently risk monitoring and reporting to be done? So the process is ongoing. There are quarterly checks There are annual reviews, but based on the reality of the grant, the review of the risk rating and the update of the mitigating action could be done on the spot based on the needs. Next, please. Who takes the lead in monitoring the risk management plan? Is it the CCM or the country team, or they have specific points individually to monitor? Monitoring the implementation of the risk management plan, each one of us has a role. The first line, the country teams, the second line, us in the risk department, and the CCM. So in DRC, we have recently completed a risk workshop where the CCM took the lead in prioritizing risk and designing mitigating actions, and the CCM will be monitoring the implementation of the risk management plan. So it's each entity and actor in the partnership have a role to play. How are unforeseen risks managed? Act of war and sanctions. So for the unforeseen risk, like for example, the war or any type of emergencies, I think within the Global Fund grant, in countries which has a very high risk index, there is a requirement to have a contingency plan. And in that contingency plan, you have the arrangement that you will have in place to mitigate the risk. And when an emergency happens, there are also the emergency funds that could help mitigate the risk. And there are also the reprogramming that could help in implementing the mitigating actions. And I think the example of continuation of Global Fund grants in Ukraine, in Sudan, and in many countries that are under crisis now attests to the fact that the system do allow for the implementation of mitigating measures and help the health system adapt to continue delivering services. I'm really sorry I have to stop because we have a portfolio performance committee happening now, and I have to be there. But we promise to respond to these questions in writing. So maybe, I don't know, Marcella, if that would work. Or how do
Yeah. Yes, Mason, we can do that, and also to to give you a break. This has been a long session, and you've responded to all of the questions. We will share the recordings. We will share the presentations. We will also respond to questions that were pending. But Mason, we can always, if this topic is really of need and interest of all our partners in country, we can also hold a second session that's just a Q&A, so that people can come and ask their questions, and we can take the time to respond to everyone. As we'll share the recording and people will have the presentations as well, we'll just give them the opportunity to come and ask more questions so we can respond. And with that, we can close, Mason, and thank you so much for the time, and thank you to everyone for the interest and for